Welcome, everybody. I'm so glad you could be with us today. My name is Gina Clonan. I'm the founding president of the Connecticut Women's Hall of Fame. For nearly 3 decades, the Hall has worked to discover and share the stories of women. Our various platforms acknowledge the individual and the collective feminine voice. There's no more important time than now to talk and listen. This will be a half-hour conversation followed by 15 minutes of your questions, which we encourage you to submit at any time during this webinar by clicking the Q&A bubble at the bottom of your screen. We'll try to get to as many as possible. Our goal is simple, a virtual gathering to talk about today's important issues. We hope this will be a useful source of information while offering up some helpful takeaways. Now, I'd like to bring on our guest. We're so honored today to launch this Zoom webinar series with our 2009 inductee, Dr. Carolyn Mazure. Dr. Mazure is the Norma Weinberg Spungen and Joan Lebson Bildner Professor in Women's Health Research and Professor of Psychiatry and Psychology at the Yale School of Medicine. Dr. Mazure created and directs women's health research at Yale. WHRY is Yale's interdisciplinary research and education center on the health of women and sex and gender differences that influence health outcomes. Dr. Mazure, thank you so much for being here today.
Gina, it's wonderful to be with you.
So, we all know we're here today to talk about women and the coronavirus pandemic. As we get started, I know that a lot of us are learning a lot of new scientific terms and pretty quickly. Sometimes this can get confusing. Just so that we're all talking the same language today, can you provide a quick rundown of some of the terms involved in the pandemic?
Yes, I think this is a really good place to start. So thank you for that question. And I also want to say thank you for inviting me today and to thank the Connecticut Women's Hall of Fame. I think the Hall is an extraordinary organization.
Thank you so much.
So you're very welcome. I mean that sincerely, as you know. So to start with terminology, I think as I say, it's a good idea to say, because what we're talking about is women in the context of the coronavirus pandemic. What is the coronavirus? What do we mean by that? So coronavirus is a type virus. 7 forms of virus that are known to infect humans. And it's named corona because when you look at it under a microscope, it has a round structure to it, and it has spike-like projections, and so it gives the impression, if you will, of a crown. Thus the name coronavirus. Now, what's important to know beyond that is it's identified only recently. It was identified, the first case of it was identified December 1, 2019. So the world has only known about this for a very short time, and we're learning a lot very quickly, but there's so much more to learn. In terms of other terminology, the particular virus that we're focusing on today, the virus we're combating in the United States and around the world, is called the SARS-CoV-2 virus. And SARS, S-A-R-S, stands for Severe Acute Respiratory Syndrome. Mm-hmm. And CoV stands for coronavirus, and 2 indicates that it's the second SARS virus that we've identified in the world. You may remember back in 2002, there was an outbreak of a virus called SARS. Mm-hmm. And that too, as the name says, was a severe respiratory disease. These 2 viruses, SARS and and the one we're talking about today and fighting today, the SARS-CoV-2, they're related genetically, but they produce different diseases. So what we need to know is when we say coronavirus, that's a broad category. We're fighting a particular coronavirus right now, and that is referred to as SARS-CoV-2. And the disease that results from this, or can result from this, is referred to as COVID-19. And COVID-19 simply means coronavirus disease 2019. So I think that's kind of an important background for people to know as they read about the virus and try to understand it.
Thank you. That is very helpful. And turning to women specifically, which is the subject today, Dr. Mazure, can you talk a little bit about the disproportionate burden on women during this crisis?
Yes, well, I think we all agree that clearly this is a highly disturbing and challenging time for everyone. And yet, because we are focusing today on the experience of women, there are a number of points to raise with regard to the pandemic. Mm-hmm. The first thing I'd like to start with, I think, because we want to go over a few points that are particularly salient, but the first point I think to start with is the issue of joblessness. So last month, when the joblessness report or loss of jobs was reported to us, we found that there were 700,000 jobs that were lost, according to the Labor Department. And of that number, nearly 60% were jobs that were lost by women. And this is in contrast to, for example, the 2002 recession, when in fact, most of the jobs that were initially lost were lost by companies that tended to be more male-dominated jobs, like in finance and construction. So this time, currently, what we're seeing instead, even though now job loss is continuing and many, many people across the country obviously have lost their jobs. Initially, women were at the front of the line in terms of having lost their jobs, because women tend to be in jobs that have high contact, whether it's in working in hair salons or working as reception individuals, whatever their jobs are, they tend to be high contact personal jobs more likely. And so those are the first jobs to go. Now, the other important part of this is the context for this point. The context for this point is, if you look at the individuals in this country who live below the poverty line, the majority of those individuals are women. Indeed. And in particular, as we know, we're talking about single mothers, we're talking about women of color, we're talking about older women who live alone. And so in that background, of women already facing poverty, facing difficulty in paying their bills, now they're dealing with joblessness and they're dealing with the pandemic.
Before we continue on that note, I see that more and more people are joining us as we speak, and I just wanted to say, first of all, welcome, and we're so glad you're here. And secondly, we invite your questions, because our chat today will be followed by a question and answer period, and you can begin to submit those questions simply by clicking the Q&A bubble at the bottom of your screen. We'll try to get to as many as possible. On the heels of talking about the virus and how it affects particularly women in terms of joblessness, let's talk too about women as caregivers, because we seem to be predominantly responsible for children and for other family members who cannot take care of themselves.
Well, that's right, because the majority of caregivers in this country are women. And we know that women who are identified as caregivers in the US Census, for example, are often doing unpaid work in caring for children with special needs, in caring for family members or friends who also need special attention of one type or another, as a function usually of some type of health problem. And so the majority of women are already working as caregivers. And in addition to that, we find that in households where we look at more minority populations, those populations tend to have households that are often very multi-generational. So it's even compounded for people of color, and particularly Black communities, where there's much more caregiving that's required of women, and that women do willingly. At the same time, realize too that 70% of women who are mothers in this country with kids under the age of 18 are also in the labor force. So you have women performing all of these unpaid and paid caregiving jobs. And again, you have to look at that in the context of managing the stress and strain of the pandemic. And I think a good place to start for us, after we talked about terminology, is the issue of work, because increasingly, as a function of public health work and studies in this area, research in this area, we're really understanding more and more about the close correlation between work, poverty, and health. And that the correlation is very clear that there's a relationship to the stress and strain of not being able to care adequately for yourself and your family, and then consequently having poor health. And when women who are in these circumstances are interviewed and surveyed in rigorous epidemiologic surveys, they do report worse health and failing health much more than women who aren't in those circumstances.
And Dr. Mazure, wouldn't that indicate not just physical well-being, but mental well-being? And
Absolutely.
that's taking on this particular group?
That's correct. And I think that's a really important point to raise. And I hope we get to talk about that a little bit more in the context of this pandemic, because there is serious concern and appropriate concern about physical health, but there be concern about how we care for our mental health.
And we see that particularly when we see a lot of women on the front lines as healthcare workers. Now, we're talking about this joblessness rate being so high in so many other areas, and pink collar society, and many of the jobs that women take up in the service industries, and all of those that have been utterly shut down. But we have a lot of women on the front lines. What can you tell us about them? And maybe that can lead to more discussion, because we see every day on television the mental health repercussions they are experiencing right now.
That's right. So as both women and men are risking their lives as healthcare providers to help us and to save our lives, many of those frontline individuals are women. In fact, according to, again, looking at census data, 75% overall of all healthcare workforce individuals are women, 75%. And of course, the percentages vary according to the particular occupation of the individual. So if you took, for example, physicians and nurses, physicians and surgeons, and you thought about physicians and surgeons as one group, about a third of that group would be women. But if you turn to other groups, like registered nurses, for example, there you start to see this enormous rise. You start to see that 85% of registered nurses, for example, in the United States are women. Mm-hmm. You also find that health aides in general, whether they're psychiatric health aides, nursing health aides, home health aides, the large majority of those individuals, again, the number's up about 85% of those individuals are women. And of the 600,000 nursing assistants in the country, 90% are women. So the workforce is really run by so many different dedicated individuals, but women play an enormous role in the healthcare workforce. And I think one other point to make with regard to that, as we're discussing that, and we'll talk about how the data is it's interesting to think about where we're getting our information and how the data are coming in. But of the data that we have, it appears that about 20% of those with COVID-19 are healthcare workers, and 3/4 of that group are women.
Wow. And speaking of that, now that we've talked about those infected, we hear a lot of news stories about how the virus itself infects women and men differently. Can you speak a little bit to that?
So we've seen reports. First of all, we've seen a study from China, and we've seen reports from Italy. There are reports coming in across this country that there really does appear to be a higher rate of infection in men and a higher rate of mortality after infection. And people are trying to understand this, and we think that this is really quite important. Because as you know, in my center, we're very devoted to studying sex and gender differences in health and disease, because we think there are major clues about the disease itself if you study those differences. And this may be another important example of that. So one possibility, of course, is that the disease in some way is affecting men preferentially because of some biology. And we know that the immune system for women and men is different. So that's one possibility that's being investigated. And in fact, we are starting to look at that very issue, what the molecular structure of the virus is and how the virus behaves. And can we tell at a cellular level if it behaves differently in women and men? But in addition, there's social behavior and social action. So men tend to smoke more than women. Men may not use physical distancing as well. They may be reluctant to use masks for one reason or another. So those kinds of things really have to be ascertained, because those then tell us how to make change in order to potentially protect ourselves from the virus.
Yeah, and that leads to a question about research. Are we collecting appropriately the data to know the very things you're talking about of how this virus affects women and men differently? Because we've often heard in feminist circles about research that has been performed, particularly in groups of men, and data that's been collected about men and men's diseases. And we do still know that we're a little bit behind in collecting that same data on women. Would you agree with that?
I would say that we've made huge strides, but we're still a lot behind in that regard. And we need to step up our game. And here too, I think in terms of the data, we need to step up our game, because as late as early April, when the CDC was putting out data with regard to prevalence of the disease, they were not disaggregating the data by sex and gender, nor were they disaggregating the data on the basis of race and ethnicity. And this is extremely important to do, because when we eventually get to thinking about how we are going to have an exit strategy, one of the things that's really going to be critically important is what you've heard about track and trace, trace and track, identify, and then what it really means is identify people who may be at risk or may have the disease already, and how they might be transferring that disease. So we need to know the demographics of those groups really well to create these geospatial maps and to really understand where the disease is going and why it's going that way. That's how we make an intervention. And so I think just like with sex and gender, we really have to study race, ethnicity. We have to study demographics of our population to understand how this disease moves.
But there seems, I mean, how is that possible within the timeframes that we're looking at, with talk of getting things started again and gearing up to where we were before, if we don't have all that data available? And much of that data depends on the testing and the tracking. And my understanding is we don't have enough of that to go around. Would that be your opinion?
Well, I think the data are clear again that only 1% of the US population has been tested at this juncture. And I think when you hear the scientists and the physicians on television, or they write about this in their news stories, they talk about this as such an important issue that we have to do better in terms of the development of tests and in terms of the availability of tests. Because as I mentioned, there are already underway that, and this is actually an important point that you and I have talked about, that when we talk about efforts underway, there are many different types of efforts. Of course, there are state-based efforts, there are federal efforts, but there are also huge academic efforts. And so there are a lot of physicians and allied health professionals and researchers and scientists who are working on these problems. And so a moment ago, I mentioned, for example, geospatial maps. So at Yale, for example, there is a group developing these projections and these capabilities to handle huge amounts of data, and then be able to examine those data in a way that's very helpful to inform us about the movement of the disease and how it's presenting, et cetera. But upstream of that, we have to have a commitment on the part of other agencies to provide the testing and to do that in a systematic way and then that data in a reliable way into these other systems. So right now, there are a lot of people working on a lot of aspects of this, and many people are starting to coordinate efforts in a very useful way through, for example, academic relationships. But we still need greater coordination of all of this, and we certainly need testing, and we need reliable testing. So you've also heard a lot about, do tests work? Again, at the same time we're using tests, we have to keep testing the efficacy of the tests, because as a function of the shortage of tests, many places, and Yale is one of them, is developing its own test because we need it here now, and we need a test that we can rely on. So that's happening at other places all over the nation. And I'm sure it's happening in other places, even in Connecticut. And as a consequence of that, which are important moves in the right direction, we also have to have quality control, and we also have to have a coordinated effort.
And when you speak of tests, you're speaking not only of the tests for COVID-19, but of this serology test that is so much in the news lately about antibody testing.
That's another important test to talk about as well. And so that work is also underway, and people are trying to understand this. But the immune system, the human immune system, is very complex. It's understandable, but it's complex. And by that I mean, for example, with regard to antibodies, there are many different kinds of antibodies, and not all antibodies are helpful for a particular disease. So as a consequence of that, it's not a generic test where somebody has antibodies or doesn't have antibodies, but it's what kind of antibodies and how are they effective in relation to this particular disease. How long do they last? Who gets them? Who doesn't get them? All of that really has to be looked at very carefully. But I will say, despite the enormous amount of work in front of us, on an optimistic note, I'm very impressed by what scientists in this country have already begun to do.
And I think you mentioned in one of our earlier conversations that what also impressed you is the global collaboration that is existing in this situation that is just phenomenal. Is that correct?
I think so. I think you can point to a number of different places where data are being shared. Now, there are problems with certain countries not providing data or not providing what appear to be appropriate data or valid data. But by and large, in general, most people are eager to share information in order to get their hands around this important pandemic.
Well, it seems that certainly there's a lot of work to do, and there's a lot of people working at it. And I'd like to go back just a little bit for 1 second about women and the stay home initiative and the safe home idea, and talk about our physical and mental health and some of the personal issues to women during this lockdown period, and for some time to come in the future, as you say, because there's so much data that has to be acquired before we can even move forward to trying to get back to a normal way of life.
Right. So this is a very important issue, and I think that we might start this part of our conversation thinking about the fact that, as you mentioned a moment ago, you only need to look at pictures of individuals on the front line, whether they be doctors, nurses, EMT people, first responders, whomever they are, and you can see the emotional toll that this is taking on people. So I think we have to start addressing this now. It's going to be important to recognize it now, and it's going to be important to think about how it's going to continue in the future. Because I think, sadly, from all this discussion, we know that there's not going to be a rapid resolution of this pandemic. So what does this mean in terms of how we approach this from a mental health perspective? What we mean is, when we look at the research and the data on stress, we find that there are a couple ways in which stress is particularly pernicious. And that is when it's experienced as prolonged and it's experienced as uncontrollable or seemingly uncontrollable. And there's so many aspects of the scope and duration of this pandemic that meet those criteria. It's prolonged, it's going to go on, we have to be resilient in the face of that. And yet, when we're at home, and even when we're not at home, there's a sense of we don't really know what's going to happen. Much of our conversation already has been about not just what we know, but what we don't know yet, and the need to know more. So we're taking that in as individuals. This is already happening to us. And I think that as a consequence of that, we can have this fairly dramatic sense of loss of control. And that's the kind of thing that leads to a feeling of being very debilitated. And so I think in terms of trying to think about how you might respond to that, what would be the antidotes for that? You certainly, and I would highly endorse what you hear generally about the importance of having good health habits, both physical and mental health habits that really are important, exercise, all of the kinds of things you're hearing about. That's true and important. And if, to the degree people can incorporate into their lives, that's important. But I'd like to offer a couple other ideas in terms of that. I think the first thing that we've learned from studying stress, and certainly this notion of prolonged uncontrollable stress, is how is it then that you bring some sense of control into your life? And I think one way in which we can do that, and this is the basis for many psychotherapies, by the way, it's one way you can do that is to create your own personal structure. And I think that's very important for people to think about what are the things that are personally rewarding to you? What are the things that you can do on a daily basis? Whether you're stuck at home or you feel stuck at home, what can you do to make that a more rewarding experience? Now, I'm not being a Pollyanna and saying, okay, you're going to turn this into a wonderful time. But I am saying you have to look inside yourself and you have to look at your surroundings and the people you're sharing this with and really try to understand what are the kinds of things that lead to you feeling like you have a purpose in life, that there's meaning for you. And that may be starting with something very simple, like making your bed every morning and making sure your kitchen's organized, or whatever it is that makes you feel good. And then it's going to involve cognitive action and thinking about things in a different form. But what we know for sure is that there's a relationship between how we behave and how we feel. And if we start to behave as though it's important to have this structure, it has meaning for us, then I think the way we feel will also be enhanced by that experience. And then the second idea that I just like to offer is when you look at the data on resilience, whether that's hardiness or grit or whatever it is, an essential component of that is really having a sense of purpose. And so within the structure that you build for yourself, and you can't force somebody else into your structure. If you live with other individuals, you have to make that meld in some useful way. You find the structure, you make it work for yourself. It's going to evolve, it's going to change based on what's happening around you. That's fine. You're not going to live up to every expectation you have, but you're going to do things that begin to reflect what you think are important. So in terms of the concept of resilience, what you're really trying to do is maintain a structure that gives you purpose, go back to your basic values, and also to value your relationships. So if you start to take those ideas in and build them the way you need to build them, I think there are ways that we can prevail.
And I think particularly for women who are notoriously famous for not taking care of themselves and putting everyone else first,
Right.
It's important to remember that by taking care of ourselves, we can better take care of those around us, particularly at a time like this. And I read online the other day to remind women again, there are no superwomen. You do not have to do it all. And particularly during a time like this, pick and choose. Let some things go. Prioritize. And instead of, having that pressure of what's going to make me happy during this time, more importantly, what can I find meaning in during this time, and sharing with your family so that there is a communal sense that we're finding meaning even in the midst of something that is so difficult to handle.
That's right. And we're finding some levels of enjoyment, laughter, aspects of life that we really value. I think that's right. And I'm reminded too of when we talk about women putting ourselves second, when you're on an airplane and they give you instruction for the oxygen mask and they say, now put this on yourself first before you put it on your children. And it's that kind of notion that we have to really take in, that we want to care for everybody else, but if we're not cared for, we won't be able to do that well.
Well, thank you so much. We're almost running out of time for this part of our webinar, but I'd like to close with one last question. In short, what can we conclude about the pandemic at this point, and what are we learning now that can help us right now or in the future? And maybe you could just talk a little bit about what's happening in Connecticut at Yale, your home base, across the state. You know, we have incredible institutions of medicine and higher education, and just an incredible state to be in. So maybe you can give us some words of wisdom regarding Connecticut and what's going on.
Well, I think that there are a few things that I might leave you with in terms of kind of rounding up our conversation. And that is to say, first of all, I want to reiterate, this is a moving target. And when you see data and then you see data change, you can't be disenfranchised from the data. You have to understand that it actually is evolving. And particularly with scientific findings. If you hear one scientific finding and then you hear something that appears as though it's different, it's not necessarily that science is reversing itself. It's that science is advancing itself. So we're learning more. So wear masks, don't wear masks, those kinds of things that seem confusing to people. It's science learning more about how to deal with the virus. And so with new information, you're going to hear changes. So don't be put off by that. Just be informed as best you can and realize that's the backstory. Then the next thing I would say with regard to your question about Connecticut, I am so impressed by the level of caregivers in our state. I mean, we're talking about the people on the front line, the people who are EMT workers, the people who are so-called non-essential workers staying home and contributing, and the people who are so-called essential workers who are going into the workplace. All of these individuals are very impressive to me. And I think if we can really rally around the fact that we have extraordinary people like that, it's helpful to us as well as letting them know it could be helpful to them. And I would say we have very talented physicians and caregivers and nurses and scientists in the state. I would depend upon them, and I would really say that any so-called exit strategy for dealing with this pandemic really has to involve medical personnel and has to involve scientists, because they actually are the most informed at this juncture about how we're going to really deal with this so that we will prevail, so that we will survive. And I think we will. If we do that and we do it in a systematic way, I think we will do well. And I think it's very impressive to see places like Yale, UConn, Hartford, other places really rallying in the face of this. I know at Yale alone, for example, out of the clinical faculty, we have seen people develop paradigms for various kinds of treatments for COVID-19. We have seen people develop methodologies to reuse PPE. We have seen from scientists new studies looking at the molecular life of this virus in order to understand how to stop it. We have people working collaboratively between our School of Engineering and our School of Medicine to develop a ventilator that can successfully be split between two patients because they have figured out how to control the balance between volume and pressure. We're seeing these kinds of extraordinary things that are coming together, and the collaborations with other institutions are very great. People are on various channels talking to other individuals, and as we said earlier, sharing information.
Well, I'm going to butt in for just one moment because we've got some great questions here. And okay, here's one that follows right on the heels of what we're talking about. Dr. Mazure, with respect to global collaboration, has Yale or anyone in the US that you know of reached out to the University of the Philippines scientists who have created a fast, cost-effective way to test COVID-19? I know testing resources are a problem, but if this can be implemented here in the US with our resources, it could be a huge win. Any comment?
Well, that's news to me, and I'm glad to hear it. And I'm not aware of that. I'm hoping that the people who are devoted specifically to testing are. And I would ask the person who provided this great question to ensure that somehow this information gets forwarded to places of interest like academic centers and maybe even actually within the Department of Health within the state of Connecticut.
Thank you. And here's another great question. Can you talk about the intersectional frame, African Americans dying at disproportional rates? How can a feminist lens on COVID help communities of color with these high fatality rates?
Right. So an important thing I think for us to remember is that in times of crisis, discrimination does not go away. In fact, it can actually increase. And we have to ensure that people who are in minority populations in our country are counted and looked at and cared for. We know that, for example, for Black communities, just as one example, that there is inequity in healthcare access and inequity in healthcare. And this can no longer go forward. We have to change this. And this may be seen perhaps as a feminist view that now is the time to change this. Not later, now is the time to change this in small ways and big ways. And even what our discussion involved in terms of ensuring that the CDC and federal agencies and state agencies and local agencies start to really count what's happening in various communities, I think is very important.
I think so too. Another one of our listeners said, I read about a woman physician who lost custody of her child to her former divorced husband because the judge agreed that the woman MD posed a threat to her child. Has this become more widespread, or was that just an idiosyncratic case? And I think perhaps this is a good time to talk about stay home, stay safe. Home is not always safe for so many women.
Well, I think that's true, and I think that it goes back to the former question as well, because many people, I think, are aware of the fact that it's all well and good to say, stay in your home, but if you have a very, very small home with a lot of people in it, it's very hard to stay safe. So I think that we have to take those things into consideration as we may just toss off this term, stay safe. We have to figure out how to help people stay safe at this time. And so I think that's really an important part of this question as well. I don't know of this instance where this report is coming forward. It sounds like a terrible situation for somebody, and I really can't comment on a specific situation. But I do know that healthcare workers are all taking risks, and it's important to support them and not a time to I guess prosecute them. But on the other hand, I can't comment on this specific case.
No, I understand, although we do know that domestic violence is on the rise, and we have run some stories about women on the front lines of the epidemic who are maybe separated or divorced, and the other partner worried that, you know, they're putting their family at risk by being out there working, and yet they have to work because that's their job, and they are required and they want to be there to help us get well. So that complicates matters for mothers and children, doesn't it?
Well, it certainly does. I would add, though, that I certainly know at Yale, and I'm sure it's true at other major facilities, that there are opportunities for caregivers, healthcare providers to stay in local hotels, to stay, actually Yale has opened up its campus, so emergency workers are able to stay at the campus and live there. By the way, there's also things going on, I think, that are important as we think about the community, which I'm always thinking about in the back of my mind. What's our relationship to the community? Yale has now, with the collaboration of the Yale New Haven Health System, opened up the large gymnasium that Yale has it's made it into a field hospital, and it's filled with beds so that we can expand our care into the community further. So I think there are things that institutions, organizations, groups can do to protect healthcare workers.
And here's a very specific question about gender and the health of women and the health of all of us. Dr. Mazure, you mentioned differences in infection between men and women. How do we think this might affect individuals who are intersex, beyond the socialized behaviors that come with gender?
Well, I think we have to step back and say that when we think about our research and the progression of our research, it wasn't that long ago that we weren't studying women. And then we were studying women. And then we were studying the way in which we understood the difference between sex and gender. And then we identified the fact that those terms were working definitions and had to evolve and change. So by the time we get to intersex or transgender individuals or speak about those concepts, we have to place them in the context that we are still learning about that. So I think it's something that really needs our attention. It should be talked about with regard to all kinds of medical illnesses, but it's certainly not something I think that's really at the forefront right now in reference to this pandemic.
And, you know, I think all of us talk among ourselves about trying to find ways that we can help. Some of us dreamed that we were healthcare professionals and we could go out and really be in the front lines and help people. And then some of us of certain age groups, even though we might be healthcare professionals, we're not even allowed to go out and help because of our at-risk populations. Here's a question that says, how can we help your team with their current efforts to analyze and visualize data? Is there anything that any of us can do to participate in all the science and the research that's going on?
Well, I hope this doesn't sound like a light touch, because I really mean it very sincerely. I think that individuals have to use their voice. I think you have to contact agencies and say to them, we want this. It's the right thing to do. You should support our researchers. When you have your exit plan, you have to involve medical personnel and scientists in that. You have to support the National Institutes of Health. You have to do things that rebuild the infrastructure in this country in a way that we have efforts that can take on major challenges like this. And I frankly have already written a letter to the editor of the New York Times. It didn't get in the paper, but I'm going to write another one the next time I think it's important to make a comment like this. I've also thought more about how we can affect the local government, how we can contact offices in Hartford and talk about the importance of how we, as a citizen in the state, think it's really important to focus more on testing. And when the governor stands up or other health officials stand up to inquire, what are we doing about testing? How is that being coordinated in the state of Connecticut? How is it being coordinated with the national efforts or lack thereof? And I think to express your voice in various ways that you have is really important. I also think it's helpful if you actually are a helper and help other people to the degree you can. And again, yes, in an ideal world, we'd all go out and be able to be on the front lines and help. But we can't all do that, and it's not appropriate for so many reasons. So how else can we help? And that's part of that meaning in life that I was talking about earlier. What is it that helps others? And I think, again, we ought not to set a standard, and we ought not to assume that we can do something that's not really realistic. But by helping your kids feel a little better in the course of the day, your partner, your spouse, your friends, by doing a call with friends, by writing to somebody you haven't written to in a while who you care about, I think those kinds of things actually are help, and they directly relate to mental health, because so many people can feel alone and isolated during this time.
Such important advice and such an incredible way to end our webinar today. I can't thank you enough for being here and talking about the importance of voice, which is something that resonates with the Connecticut Women's Hall of Fame, and talking about the ways that we can help ourselves and help others during this difficult time. Thank you again. I really do appreciate your being here. And I'd like to thank all the participants who joined us. Thank you for your kind questions and for listening. And I'd like to remind you to join us next week when I will be speaking with Dr. Helen Smits, retired policy shaper and healthcare advocate, also an inductee of the Connecticut Women's Hall of Fame, whose compassion and caring have enabled her to affect people all over the world. During this webinar, we're going to be discussing the impact of the coronavirus pandemic on older adults. We'll touch on topics such as congregate living, safety of nursing homes, and the challenges faced by loved ones. You can register for this webinar by visiting our website, cwhf.org, and at the top of the page under the title, What Do We Do?, you'll find our webinar information. Thank you again, Dr. Mazure. Thank to all of our participants, and we look forward to the next time we can have a conversation between.
Thank you, and I appreciate the questions, and I appreciate people's participation, and keep the faith, and take good care.
Thank you again. Goodbye, everyone. Have a great day.